Time now with our sports health conversation driven by the folks over at Auctioneers. Dr. Jeremy Burnham gives us time every couple of weeks. He's on Jim's Firearms Hotline. Dr. Burnham, how are you?
Hey, good afternoon, Hunt. Doing great.
Glad to hear it. The first question I have for you, we don't have any concrete evidence or any sort of real information on this. I'm just curious because you're a medical professional and see stuff like this all the time. Jacarius Peak is a offensive lineman that transferred to South Carolina, slated to be their left tackle. Huge addition for Shane Beamer's team. And in a team building exercise, they played a 3-on-3 basketball tournament, and he got hurt to the point where he's going to miss all of spring and all of summer. We don't know how he got hurt, but you see basketball injuries all the time. You see football injuries all the time. Y'all have dealt with folks that are 6'6", 330 pounds. Like, would you allow your football team to play off-season 3-on-3 basketball?
Hey, that's a great question. It's definitely a unique mix between the basketball injury and the football athlete. Now, this is a guy. He was, I think, one of the top portal transfers this year, right? So I think pretty big news coming out of an SEC rival here. I mean, I think it's a tough call, right? So basketball develops a lot of skills, a lot of hand-eye coordination, a lot of footwork that I think is beneficial in football. And also there's the team building aspect, right? I think we all, all of our groups or teams or anybody can relate to wanting to do some of these team building things. If no injury would have happened, then we wouldn't have been talking about it. It probably would have been a positive thing, but certainly a lot of eyes on it. I think this is a guy that I don't think he had much of an injury history prior to this. I think he started a lot of games, 30 or 40 games without major injuries, to my knowledge. So certainly a development. It sounds like it's probably not a full ACL tear. I think, did they say he's coming back, I think this summer maybe, or maybe the fall?
Right. And I don't even know if it's a knee, lower leg. Like, who knows exactly what happened, but clearly he didn't tweak his ankle. Like, something happened if he's going to miss 6 months here.
Something enough that he's going to be out for a little while. You would think that it's probably in line with maybe like an MCL type injury with maybe a bone bruise or a possibly meniscus tear. I don't think I've seen anything publicly released. If it's an ACL, you're thinking 9 to 12 months. This sounds shorter than that. These big guys, they put a lot of torque in their knees. They can do a valgus maneuver where their knee kind of bows in, and that's what stretches the MCL. So I think that's likely to be a part of it, but we don't know a lot about it. I think, you're looking at that 3 to 5 months. He's probably going to be back in sport-specific things, and hopefully for them, be back at the fall. And it sounds like it's probably a non-contact injury. You can get hurt doing anything. I tell my patients that all the time. You just got to be smart about it. Some things you can't control.
I would tell Coach Beamer maybe look into paintball, water slides, maybe some bowling, as opposed to a 3-on-3 basketball tournament with a bunch of 6'5"
Not
dudes.
Pickleball. I can tell you that. Not pickleball. I've
Really?
seen those injuries. Oh,
okay.
Yeah, lots of pickleball injuries.
Interesting, because my wife's all about pickleball these days. It's National Athletic Training Month, so let's talk a little bit about that. I know y'all have got an incredible staff over there at Elite as well as Auctioneer.
I think athletic trainers are the core, the backbone of sports medicine. I've said that before on the show, Hunt. And, you probably have seen athletic trainers or athletic trainers have been around you when you didn't even realize it. They put in crazy hours. I mean, early mornings, late evenings. This is obviously can be all the way from the professional setting down to your middle school athlete that's playing a game, but also companies like Amazon and some of the different industries out there are starting to employ athletic trainers. And they really, a lot of times are the unsung heroes. We all remember Damar Hamlin when he went down, and it was athletic trainers that kind of sprung to his rescue. And so they're very, very highly skilled, very, very educated, very, very hardworking people that if I'm out there playing pickleball or whatever it is, I want an athletic trainer close by. This is a month in March that we take every year to recognize athletic trainers. If you see an athletic trainer, I just encourage people to thank them. They probably don't get thanked enough, and just tell them how much you appreciate them.
No question. Jay Johnson is very meticulous about everything that goes on at LSU baseball, and he thanked their trainer last week in a big way for everything that's going on over there. So it's a big deal, obviously. What's going on over at Elite? We got about 90 seconds left.
Yeah, hey, we got a lot of good things going on at Elite. We're always working on our ACL prevention stuff. We talk about that all the time. A lot of our team actually is getting recognized at the American Academy of Orthopedic Surgeons this week. We have several surgical technique videos and some different research that we're doing getting represented there. So proud of our team making waves there. Always, we have our walk-in clinic. We're going to be expanding those hours soon, so we're open 7 days a week. You can just walk into the Elite facility and get seen for an orthopedic issue.
Appreciate your time very much, Dr. Burnham. Have a great rest of your week, and we'll talk very, very soon.
Talk to you soon, Hunt. Thanks.
That's Dr. Jeremy Burnham with Ochsner. The weather is warming up at Ochsner Andrews Sports Medicine Institute. Know that sports injuries can be unpredictable. One situation you can protect yourself from is muscle cramping. One of the first things you can do to aid in recovery to avoid muscle cramping, stretch prior to and at the end of your activity. Not drinking enough fluids, that can lead to muscle cramps as well. Be sure to stay hydrated as that weather warms up. To learn more about sports injury prevention and treatment, visit Ochsner.org/BRortho. That's Ochsner.org/BRortho.